Hello, my name's Dr. Rory Hicks. I work at the Oldham Royal Hospital. I'm a Foundation Year 2 doctor. The reason why we're striking today is because 98% of junior doctors have voted for emergency care striking. So that tells us that this contract that they're trying to force upon us is unsafe for patients, they won't receive safe care, and it's unfair for us, which means we're going to be working long hours, which means there's a European Work Time Directive that they're throwing out the window. They're removing all safeguards for us. It means we could work anything up to 100 to 120 plus hours a week, which means we'll become very tired. Tired doctors will make mistakes, and in healthcare, unfortunately, mistakes means it can cost lives. So we've tried negotiating. You saw the BMA has put in the strikes because we were negotiating with ACAS, and unfortunately it's been unsuccessful. So this is the last resort. Our hands have been forced. We need the government to take note of us, of what we're saying. We want our voices to be heard. 98% of junior doctors is tens and tens of thousands of voices, so we're very, very angry about this, and it should be...
Yeah. Is it about pay? Is it about you basically holding out for more pay?
No. No. So basically, the issue about the pay is it's getting totally misspun by the media, unfortunately. They're describing it as 11% pay rise. That 11% is on basic pay, and anyone that sort of is familiar with how junior doctors or the NHS staff get paid is we get half our basic salary, which is what the 11% rise is. But also we get extra for the unsociable hours and the sort of weekends, nights, etc, etc. And that's what we get paid more on. That's what they're thinking about wanting to cut our pay by 30%. So basic maths means put 11% pay rise and 30% cut, but still a net loss.
Yeah.
So mainly it's about providing safe care for our patients. If you're going to ask a person to work over 100 hours a week, we can't provide safe care. But asking someone to work over 100 hours a week and then docking their pay by 20% is outrageous in our opinion. So the sole thing is not mainly about pay, but obviously if you cut our pay by 20%, that's not fair. People have mortgages, people have families, they can't just provide and keep living the way they're living with 20% pay cut.